Bonjour à tous. Je voudrais commencer ce matin en faisant le point sur le déploiement
Taking stock of the deployment of members of the Canadian Armed Forces in long-term care facilities in Quebec. Men and women in uniform are doing an incredible job. They're saving lives. Since the end of April, the situation in several of these institutions has stabilized. Many workers are going back to work. This means that the members of the armed forces who have been deployed to these facilities where things have improved can now be sent to other centres where the situation is more critical. We've been able to help more than 35 facilities to date, and we're continuing to redeploy members of the Canadian Forces from centres where things are under control to centres where things are more difficult. So we'll be extending the current mission until the 26th of June. I'd like to be clear here. The 1,400 military staff under Operation Laser are still in Quebec, and they're currently being redeployed into long-term care facilities that need them. We're continuing our discussions with the Quebec government to develop a medium-term plan which will allow us to support Quebec until the 15th of September. This plan includes active participation by the Red Cross with well-trained and paid people who will be just as effective as the armed forces. The federal government will continue to be there for Quebecers.
Our government has been working with the provinces on providing care for seniors and the most vulnerable. This includes by deploying members of the Canadian Armed Forces to certain long-term care facilities. In Ontario and Quebec, we are extending this deployment to June 26th. Our women and men in uniform are doing a remarkable job. Their help is still needed, so we're making sure that our elders continue to have this vital support. To restart the economy, to get Canadians back on their feet, we need a coordinated, countrywide plan. And at the heart of this approach must be how we do this safely. In country after country, state after state, a pattern is emerging. People make sacrifices needed to flatten the curve, but then when governments decide to restart the economy, cases begin to rise again. And after months of hard work, people are finding themselves right back where they started. Canada must learn from these lessons. It's clear that we have to make safety and control of this virus a top priority in this restart. So that's exactly what we're doing. Our government is working with the provinces and territories to bring in the right measures to keep Canadians safe and healthy. Last week, I put forward our government's commitment, $14 billion towards a safe restart agreement for the things that Canadians will need in the 6 months ahead. At our First Minister's meeting yesterday, the Premiers, the Deputy Prime Minister and I continued our discussion on what this plan might look like. We talked about the measures needed, whether that's childcare and paid sick leave, contact tracing and testing, or PPE and support for the most vulnerable. And we talked about the fact that we must keep working together to support Canadians right across the country. Hier soir, les premiers ministres et moi
Yesterday evening, premiers and myself also talked about videos and reports that are currently circulating which show violence against Aboriginals and Black people here in Canada. During our discussion, I talked about the changes we should make to the police, including the wearing of body cameras. All levels of government must work together to ensure that things change as quickly as possible.
Chief Adams' arrest, and we must get to the bottom of this. Like many people, I have serious questions about what happened. The independent investigation must be transparent and be carried out so that we get answers. At the same time, though, we also know that this is not an isolated incident. Far too many Black Canadians and Indigenous people do not feel safe around police. It's unacceptable, and as governments, we have to change that. In my discussion with the premiers yesterday evening, I brought this up. All leaders were united in condemning racism and in agreeing that we must do more to combat it. I raised with them some of the ways we can work together moving forward, including on practical things like the adoption of body cameras. This is something I've already discussed with RCMP Commissioner Lucky. But reforms are needed at all levels of policing, and these reforms need to happen quickly. In the days and weeks to come, our government will continue to move as fast as we can with all of our partners. Women and men who serve in our police forces must be part of the solution. They are people who've stepped up to serve their community, and they will be invaluable allies as we move forward to make sure that all Canadians are well served by these institutions. Today, I also want to speak about the progress we're making on travel and on our work to keep Canadians safe. Right now, physical distancing is still the best way to protect yourself and others. Of course, there are some places, like on flights, where it's not always possible to keep 2 meters apart. That's exactly why we've made it mandatory for travelers and staff to wear masks. We've also worked with airlines and airports on standards they should have in place, whether that's enhanced cleaning or putting distancing measures as people wait in line. And today, I can announce that we're taking another step forward. Our government is mandating temperature screening for air passengers through a phased approach. First for those traveling to Canada, then for those traveling from Canada, and finally for those traveling within Canada. A passenger who has a fever will not be permitted to board their flight. Employees in the secured areas of airports will also be required to have their temperature checked. There are strong measures already in place to keep people safe, and this screening will add yet another layer of protection. Our government
has taken note of best practices in place across the world to protect people. This is why today I'm announcing that we're making temperature screening compulsory for air passengers as well as for staff and employees. Minister Garneau will have a lot more detail on this later today. Over the next weeks and months, we'll continue to explore other ways of protecting Canadians and also to limit the spread of the virus as well.
Right across the country, in every city and town, Canadians are stepping up to help. If you want a great example, look no further than the Filipino-Canadian community. In Surrey, the community set up a blood donation drive as their way to pitch in. In Calgary, an organization called Fiesta Filipinos is raising money for care packages for families. À Montréal, la communauté philippine a mis sur pied
Montreal, the Filipino community has set up a mobile food delivery service to deliver food to those who are in isolation today. On Philippine Independence Day, we're recognizing all the contributions that have been made by Filipinos to our country. It's also the opportunity to speak out against the obstacles that this community still faces today.
Filipino Heritage Month, we can't ignore the ways in which our country must do better. Too many members of this community face discrimination, something that has gotten worse because of this pandemic. There is no place in this country for racism against Asian Canadians or anybody else. Now, more than ever, we need to stand up against discrimination and injustice in all its forms. As Canadians, we are always stronger together. Merci.
Thank you, Prime Minister. We'll now go to the phone for questions. One question, one follow-up. Operator.
Thank you. Merci. Première question, Raymond Fillon.
Raymond Fillon from TVA, first question. Thank you. Hello, Prime Minister. First of all, on military staff in long-term care facilities, it's not a long-term solution, but why are you keeping 1,300 troops in these centres until September? Well, we sent the Canadian Armed Forces into long-term care facilities in Quebec because there was an urgent crisis. An urgent crisis control of the pandemic had been lost within these centres over the past 2 months. However, we've seen improvements. We've seen net improvements in the way these centres actually function. We've seen workers and coming back to work. And that's thanks to the work that's been done by the Canadian Forces. Now, we do recognize, even if it's not a long-term solution, the protocols and practices have actually been put in place that will continue over the medium and long term. Now, in terms of staffing, we're working with the Canadian Red Cross to get properly paid staff, well-trained staff, who will take over from military personnel. So until the 15th of September, Canada will be there in Quebec to help in these long-term care homes. I think it's a reasonable approach. It's based on needs on the ground. We're working to develop this plan with the Quebec government as well. A follow-up question? Mr. Legault yesterday afternoon said that we need 1,000 military staff. Are you saying that it's mission accomplished, that Quebec no longer needs these people? No, the mission's not being completed yet. There's a lot of work that still needs to be done. And for as long as there are challenges, the government will be there to help in these long-term care homes. But at the outset, we sent in the military, but it could be, in fact, well-trained, well-paid staff from the Red Cross. They could be in a position to take over from the military. But as I've said, we will continue to be there as a federal government to help Quebec to actually get control of the situation in these facilities.
As I said from the beginning, we were going to be there, and we are there to help out our seniors in the long-term care facilities in Quebec. From the beginning, they were there to stabilize the situation, to set in place protocols and measures that were necessary while the situation was out of control. But over the past couple of months, the extraordinary work done by the members of the Canadian Armed Forces has made a huge difference. And many facilities have gone from condition red to condition green. We will continue, as a federal government, to ensure that our seniors in Quebec are protected. We are proposing and working with the province of Quebec to progressively replace those military members with trained people from the Canadian Red Cross who will be paid, who will be properly trained to be able to continue the important work being done while Quebec works to get its system back under control.
Merci. Operator, prochaine question.
Thank you. Merci. Prochaine question. Lina Dib, La Presse canadienne. À vous.
Canadian Press. Mr. Trudeau, I'm sorry to ask you a question about this topic again, but I fail to understand what's preventing you from keeping the military in the long-term care facilities. And Mr. Legault, based on his assessment of the situation, says he needs 1,000 military staff in the long-term care facilities. So why can they not stay? Well, they are there, and they'll stay there to protect Quebecers, to protect all Canadians. In fact, they've done an extraordinary job over the past 2 months, and they're continuing to do what we send them to do in these long-term care homes in several long-term care facilities. They've been able to significantly improve the situation, and now they can be moved to other facilities in a more critical state. We know that the military were never going to be a long or even a medium-term solution. This is why we'll be gradually replacing these military staff by members of the Red Cross. They'll be doing everything that the military were doing. They'll have the proper training, they'll be properly paid, and that will allow us to make sure that Quebecers remain healthy right up until the 15th of September. And of course, beyond the 15th of September if they need it. Follow up. Well, it doesn't really answer my question. Now, the Red Cross. What's preventing the Red Cross from already being deployed? Mr. Legault estimates that there are only 400 military in the long-term care facilities. He needs 1,000. So what's delaying you sending in these well-trained Red Cross members? Well, Lena, I'd just like to point out that we have sent 1,400 military staff into the long-term care facilities under Operation Laser. Now, these 1,400 military staff are still there under this Operation Laser. But as I've said, as long-term care facilities get a control on the situation, these military can be redeployed to other centres, and they are being redeployed. But what we have to do is to assess and to follow a proper process. That's why the numbers are fluctuating a bit now. But in terms of the Canadian Red Cross, what we're doing really is working with them, but also with the Quebec government to develop the plan that'll allow them to be deployed over the next few weeks to take over from the military. Next question.
Thank you. Next question. Teresa Wright, the Canadian Press. Line open.
Yes, good morning, Prime Minister. I'd like to ask you about the video of the arrest of Chief Allan. The RCMP said the treatment of Chief Adam was reasonable. Can you explain that to all the people who have now seen this video?
I think everyone who's seen this video has serious questions about what exactly happened, about how it happened this way, and about that use of force that we saw. That's why we're calling for an independent, transparent investigation that will get the answers that so many questions people are asking right now. Okay.
Well, I think everyone who's actually seen the video has serious questions about it, and that's why we're calling for an independent investigation, a transparent investigation, which will provide the answers on how this actually happened.
Yes, thank you. On another topic, you've been promising to end the blood donation ban on men who have sex with men and trans women since 2015. Other countries have done this years ago. Why have you not yet kept this promise?
Our decisions from the very beginning have always been anchored in science and data. From the very start when we took office, we made significant changes to shorten the wait times, but they were still unacceptable. That's why we gave funding to Canadian Blood Services and Quebec to do the studies necessary to be able to bring in new protocols, and we are very hopeful that we'll be able to announce the results and the change very soon. Okay.
Well, right from the start, we've recognized that we needed to change protocols to allow blood donations from everyone in the country. That's why we've invested in Quebec and Canadian Blood Services. We've invested millions of dollars in these two bodies to allow them to do studies based on science-based studies to adopt new measures. And I hope that we'll have an announcement to make shortly.
Thank you. Merci. Next question, Ryan Timothy, National Post. Line open.
Yes, sir. I wanted to ask you a follow-up about the Chief Allan video. Given what you've seen, given the fact that the superior officers there decided initially that there was no problem, that the force wasn't excessive, do you think that's part of the systemic racism issue that you've seen in the RCMP? And are you concerned about what that says about how the RCMP senior officers view force?
I think we've seen examples of systemic discrimination, of systemic racism in the past days in many different ways. That's why we need to address it seriously. That's why we need both clear, independent, transparent investigations in the cases brought forward. But it's also why we need to look at the entire system to improve it, to make sure that situations like this don't happen in the future, and that our police officers who are there to protect and serve all Canadians are able to do that for all Canadians. Okay. Je pense que les incidents qu'on a vus récemment.
Well, I think the incidents we've seen recently really point to the need for transparency and investigations on these incidents, but also that we need to look at the system to make sure that all Canadians are properly served by the police.
Yeah, sir, just on another issue, after the bill failed to move forward Wednesday in Parliament, you said you'd continue working on it, that you wanted to get the payment out to people with disabilities. I'm wondering if you've made parties opened up and made more negotiations, maybe changed some of your previous stances to help move that bill forward.
We are very hopeful we are going to be able to move forward to deliver for people with disabilities across this country. We know that they're facing extra costs because of this pandemic, and that's why we moved forward a bill, and we even offered to separate out that bill so just that measure could be moved forward on. Unfortunately, as we saw, other parties did not want to move forward even on that one thing. So we're now looking at ways of perhaps being able to deliver that without having to pass through legislation, but it will be more difficult and may take longer.
Bonjour, Monsieur Trudeau. Philippe Vincent Foisy de Radio-Canada.
Philippe Vincent from Radio-Canada. First of all, on the decision by the Supreme Court on the BC Francophone School Board, while the Supreme Court has forced the province to pay money to the school board for French language, for French language schools, but the province says it doesn't have the necessary funds to properly fund those schools. Will the federal government help the province to make sure that Francophone minority language communities can have access to quality education no matter where they are? Well, as a government, it goes without saying that we've taken various steps to protect and to strengthen protections for minority language groups across the country. Now, the Supreme Court decision is good news for the communities in BC and for our country in general. Communities have been telling us for a long time that the provinces are failing to provide adequate funding for the services that they're required to provide. And we hope that the provinces will now provide more protection, better education, more funding for these communities. But we recognize that this is a provincial jurisdiction, but we are there to help nevertheless.
Decision is good news for minority language communities right across the country who've long felt that they haven't been receiving the right levels of services from their provincial governments. As a federal government, we've moved forward in many ways to strengthen protections and support minority language communities across this country. But we now hope that the provincial governments will step up further in areas that are their exclusive jurisdictions, like education and certain services for minority language communities. As a federal government, we will always stand ready to support and help minority language communities across this country.
Sur la prise de température pour les passagers.
On temperature screening for air passengers, do you think that people will find it difficult to trust you? Because from the outset you've said that masks didn't work. You said that closing down the borders didn't work either. Now you've flip-flopped on that. Now, if temperature screening worked in the past, and you said it didn't, why are you deciding to do it now? Do you think that people will actually trust you when you're putting in place measures like this now, when you said they didn't work in the past? Well, we talked about this, the idea of temperature screening several weeks ago, and we were told that it's not a very effective way of screening people for COVID-19, but it's an additional measure which will detect people who are sick and who should not be traveling or who might have COVID-19. We looked at these measures a couple of weeks ago, and at that point there were almost no air travel across the world. So we didn't need these screening measures then, but now we're thinking about reopening the economy. We're thinking about perhaps allowing more people to come into Canada over the next few weeks. So we'll perhaps have to follow in the footsteps of other countries and put in place these additional measures. So they're not 100% effective, but there's another reasonable level of protection. Of course, the best thing is to encourage people to stay at home, but these are additional approaches, additional measures that will further protect Canadians, I think.
We talked about The idea of thermal screenings for travelers a number of months ago. It was highlighted at that point and still remains the case that it is not a way of detecting COVID-19 in travelers. But it is an additional measure that can highlight symptoms of COVID-19, can highlight if someone is ill and shouldn't be traveling at all. It's not the panacea, it's not a 100% solution. It is an extra layer of safety to encourage people who might feel sick to stay home and not travel and put others at risks. And it also aligns with what many of our international partners are doing as well. It is something that is an additional measure that can make a difference, but it has to be included with a suite of measures that we're moving forward with to keep Canadians safe.
Brian Mullen, Global News. Just to follow up on one of the earlier questions, Prime Minister, when a young man took it upon himself to fight the blood ban at the Human Rights Commission, your government chose to fight him in federal court. Will you drop that case? And can you clarify that the changes you're planning to announce will mean an elimination of the 3-month deferral?
The policy on MSM blood donations has long been discriminatory. But we know, and Canada has learned through strong, unfortunate experience, that the safety of our blood supply is something that we have to anchor in science. And that's why when we got elected in 2015 with a commitment to end the blood donation ban, we heard that the science was not there to be able to do it. We said, okay, well, here's millions of dollars for the Canadian Blood Services and Quebec to do the research necessary to be able to eliminate that ban safely so that we can still have a safe blood supply and we can move forward on ending discrimination against the LGBT community. We have made significant steps forward. We will continue to anchor our decisions in science and protections of Canadians. But as I've said, we will work to end this discrimination. Okay.
Well, as I've said, it's a discriminatory process against the LGBTQ community. We'll be working with Quebec and Canadian Blood Services to ensure that we can take a safe, science-based approach in moving towards removing these discriminatory practices, and we'll have a lot more to say on that quite soon.
You just said that your decisions are anchored in science. That's something you've been saying repeatedly throughout this pandemic. But science has shown that temperature checks did not stop the spread of SARS. Dr. Tam, Canada's top doctor, has also said that it's not an effective tool for detecting people with COVID-19. So if you believe in making your decisions based on science, why are you backing this when the science isn't there?
Science has certainly shown that people with fevers should not travel on international airlines at a time of pandemic. This is not, temperature checks will not be detecting cases of COVID-19. Science is very clear that it is not a surefire way of screening out people with COVID from people who don't have COVID. It is an extra layer of protection on top of many others that can have positive effects on people who decide that since they stay sick, they will stay home and not travel rather than be turned around at the airport. It's an extra layer of protection for people coming into Canada, but it is not the one surefire way of keeping Canadians safe. I absolutely agree, obviously, with the science on that. But it is a measure that we can move forward with that, in addition to other measures, can be effective at making sure that Canadians are kept safer.
Well, we're fully aware that temperature screening will not detect COVID cases. It goes without saying that it's not a reliable test. But it's an additional layer of testing to encourage those who are sick not to travel, to detect people who might have COVID-19 symptoms. It's an additional layer which will protect people. People expect us to take the steps that are required to protect them, and that's what we're doing.
Chief Adams being tackled without warning. Do you believe that those officers should still be members of the RCMP? And what does it say to you that the RCMP commissioner has seen that video and doesn't understand the definition of systemic racism?
I think it's extremely important that we have an open, transparent, independent investigation into that incident and many other incidents like that. There is important answers to have on these specific things, but also on the pattern that we are seeing of why so many Indigenous Canadians or racialized Canadians are afraid when they are interacting with the police. These are things that we need to address, and we're working on it together. Okay. Je pense que ces incidents soulignent d'abord.
All these incidents really show us that there's a need for direct, open, transparent investigations on these incidents, but it also points to a problem of systemic discrimination within our institutions. Aboriginals, racialized Canadians don't feel safe when interacting with the police very often.
So you've talked today about the need for reform within the RCMP. You've said you're disturbed by the arrest dashcam video of Chief Adam, while the Wood Buffalo RCMP found the actions of the officers reasonable and not really worthy of further investigation. We've also heard comments from top brass within the RCMP questioning whether there's systemic racism in the force. Do you still have confidence in the top leadership of Canada's National Police Force to make the necessary reforms that you say are needed?
The events that have been brought to light over the past days highlight that, without question, there is systemic discrimination within our institutions, including within the RCMP. We need to move forward to correct that, and I continue to have confidence in Commissioner Lucky for the changes that she's made already within the force and the more changes we need to make quickly to ensure that the women and men who serve in our police forces across the country, including the RCMP, can better serve their fellow Canadians, particularly Indigenous and racialized Canadians. Je continue d'avoir confiance dans la commissaire.
Well, I continue to have confidence in Commissioner Lucky for the things she's done and the things she will be doing. There's no doubt, however, that there's an issue of systemic discrimination within our institutions and within our police forces, including the RCMP, that we must address, and this is what we will do.
Following up on that question, given that Commissioner Lucky still has to learn what systemic racism is she not an impediment to the swift reforms that you say are needed?
I think there are an awful lot of people who are learning just this week what systemic racism actually is and what it means for racialized Canadians, for Indigenous Canadians. There are some deep changes we need to make in our institutions, and we need to work with people who want to make those changes, who want to be part of the solution, and I know Commissioner Lucky is one of those.
One of the reasons why Canadians can dismiss the existence of systemic racism and dismiss these incidents as anecdotes and one-offs is because your government has not mandated the collection and release of disaggregated police use of force data. Will you do that, and when?
We have made significant steps over the past years on the collection of disaggregated data. We need race-based data to be able to understand exactly what's going on, whether it's in our communities, whether it's with policing, whether it's in financial sectors. Understanding the vulnerability that certain Canadians face in a systemic way is extremely important, which is why we have moved forward on disaggregated data, but why we will need to continue to do much more to better understand how our systems are unfair towards certain Canadians, particularly Black Canadians, Indigenous Canadians, and racialized Canadians.
So will you release
Merci beaucoup.
data?
All right, Editor Thompson, with you again on CPAC. As you
de vous être rejoint à nous aujourd'hui. Today, we will hear from le ministre des Transports, Marc Garneau, sur la vidéoconférence, et le président du Conseil du Trésor, Jean-Yves Duclos.
Minister of
Marc,
Transport and Jean-Yves Duclos.
Merci, Christian.
Thank you, Christian.
Bonjour tout le monde.
Hello, everyone.
La pandémie de COVID-19 a créé une crise mondiale sans précédent et a eu d'importantes répercussions sur tous les aspects de l'industrie canadienne des transports, sur les voyageurs et sur notre économie. Le gouvernement du Canada est résolu à protéger les Canadiens et aider à éviter que le transport aérien soit une source de propagation du virus. As Minister of Transport, my highest priority is the safety and security of Canadians and the transportation system. That's why, since the beginning of the pandemic, we began introducing a range of measures to reduce the risk of the spread of COVID-19. These include mandating face coverings for travelers and transportation workers, conducting health checks for those who must travel, and publishing health guidance for the air industry. Today, I am pleased to announce another layer of protection to our approach. Starting later this month, air operators will be required to conduct temperature screenings at the point of departure for all passengers on international flights entering Canada. This will apply regardless of the passenger's point of origin. This measure is in addition to the existing health check questions for symptoms and helps ensure that no passenger travels to Canada with an elevated temperature. By the end of July, the Canadian Air Transport Security Authority, or CATSA, will become responsible for temperature screening as part of the departure procedures for domestic, transporter, and international flights. Airport and aviation personnel will also have their temperature checked by CATSA before entering the restricted area of airports to help maintain a healthy and safe place for travelers and workers alike. À partir de la fin juin, les exploitants aériens devront effectuer une vérification de la température de tous les passagers des vols internationaux à destination du Canada avant l'embarquement au point de départ. Cette mesure s'applique quel que soit le point d'origine du passager. D'ici la fin du mois de juillet, l'Administration canadienne de la Sûreté du transport aérien, ou l'ACSTA, sera responsable de faire une vérification de la température des passagers dans le cadre des procédures de contrôle avant le départ des vols intérieurs, transfrontaliers et internationaux. L'Administration canadienne de la Sûreté du transport aérien vérifiera également la température du personnel des aéroports et de l'aviation avant qu'ils accèdent aux zones réglementées des aéroports, et ce, afin de maintenir un espace sain et sécuritaire autant pour les voyageurs que pour les travailleurs. Once again, this is in addition to the health screening questions and the wearing of face coverings that are already required. By the end of July, we are aiming to have temperature screening stations set up in the departure section of Canada's 4 largest airports that are currently accepting international passengers. By the end of September, temperature screening stations will be placed in the departure sections of the next 11 busiest airports in Canada. All passengers who have an elevated temperature confirmed after a second reading will not be permitted to continue their travel and will be asked to rebook after 14 days. La vérification obligatoire de la température est une autre mesure mise en place par le gouvernement pour protéger la sécurité des voyageurs et des travailleurs du secteur du transport aérien. Ces mesures permettent de veiller à ce qu'aucun passager qui se rend au Canada ou qui en sort, ainsi que ceux qui prennent un vol domestique, ne présentent un risque pour les autres passagers en voyageant avec une température élevée. Comme toujours, nous ferons le suivi des mesures prises et les étendrons aux besoins. En conclusion, je voudrais remercier les voyageurs et les travailleurs de tout le pays qui contribuent à assurer la sécurité des Canadiens en suivant toutes les mesures relatives à la COVID-19 mises en place.
All COVID-19
Merci.
measures. Thank you.
OK. Merci, Marc. Et maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. Jean-Yves, s'il vous plaît.
Merci, Christia, et merci, Marc. Bonjour tout le monde. Good morning.
Thank you,
Good
Christia.
afternoon,
Good morning.
everyone. The Prime Minister made several important announcements this morning. I will focus on one. C'est celui du renouvellement de la présence des forces armées canadiennes jusqu'au 26 juin prochain. Deux messages principaux. Le premier, c'est que le gouvernement canadien a toujours dit qu'il allait être là pour prendre soin des aînés. Le deuxième message principal, c'est que rien n'a changé depuis quelques semaines. Les 1400 ou presque membres des forces armées canadiennes qui sont sur place au Québec continuent à être sur place encore aujourd'hui et vont l'être jusqu'au 26 juin. Une autre bonne nouvelle, c'est que le premier ministre canadien s'est engagé à ce que le gouvernement canadien soit là pour aider les aînés jusqu'au 15 septembre prochain, comme il a été demandé, et qu'en plus de ça, des forces additionnelles vont s'ajouter, celles de la Croix-Rouge canadienne, des gens volontaires, formés et payés pour apporter un supplément de ressources à celles qui ont déjà été fournies par le gouvernement canadien jusqu'à maintenant. C'est une très bonne nouvelle parce que ça dit qu'au cours des prochains mois, en plus des efforts du gouvernement canadien, du gouvernement québécois pour fournir davantage de personnel formé et payé, il y aura la contribution de gens payés et formés et donc capables d'aider de la Croix-Rouge canadienne. Donc de très bonnes nouvelles qui nous permettent de collaborer encore davantage et encore plus longtemps entre les deux gouvernements.
Collaborate with the government
Merci
of Quebec.
Jean-Yves et
Thank
on
you,
est prêt
Jean-Yves.
maintenant à répondre à vos questions.
And we are now ready to
Merci,
answer
Madame
your
la Vice-Première
questions.
Ministre. As
Thank
usual,
you,
we'll start with
Deputy
three
Prime
questions on the
Minister.
phone, one question, one follow-up, and then we'll turn to the room. Operator, over to you.
Thank you. Please press star one at this time if you have a question. Appuyez sur l'étoile 1 maintenant si vous avez une question. Notre première question est de Raymond Fignon de TVA. À vous la parole. Please go ahead.
Oui, bon vendredi, merci. Question pour le ministre Garneau à propos des détecteurs de chaleur, de fièvre, là, si on peut appeler ça comme ça. Vous prévoyez que ça va coûter combien et qui va défrayer la facture pour l'équipement et le personnel? Est-ce qu'il y aura du personnel additionnel de nécessaire?
Merci pour la question, Raymond. Les coûts exacts sont très modestes, mais on ne les connaît pas encore parce que c'est l'ACSTA qui sera chargé de faire l'achat de l'équipement pour que ça soit déployé, comme je l'ai mentionné, dans 15 différents aéroports. Alors, il y a un choix de différents instruments qui pourraient être utilisés, qui doivent avoir une certaine précision, mais l'ACSTA est capable de payer pour ces instruments pour mesurer la température à l'intérieur de ces budgets.
Alors, suivi, qu'est-ce qui vous a fait changer d'avis? Parce qu'il y a quelques semaines encore, on me disait que c'était pas efficace. Ottawa semblait vraiment lever le nez sur cette technologie-là. Quel a été le point tournant?
Laissez-moi vous dire que d'abord, je suis un ingénieur, alors je crois en la science et je peux vous dire qu'il y a de hautes probabilités que si quelqu'un a la COVID-19 et a une température, il veut prendre un vol, nous avons de très hautes chances de le détecter. Et j'ajouterais également que vous le savez que l'OACI et l'IATA, deux organes internationaux reliés à l'aviation recommandent les prises de température. Vous savez que Air Canada et WestJet ont déjà mis en place des mesures. Beaucoup d'autres pays soit ont déjà mis en place le même programme ou sont en train de le contempler. Et aussi, il faut se rappeler que beaucoup d'informations basées sur le SRAS qui s'est produit en 2003, si ma mémoire est bonne. C'est une pandémie qui vraiment a seulement affecté un très petit nombre de personnes. Tandis qu'aujourd'hui, nous faisons face à un virus qui a déjà infecté des millions de personnes dans presque tous les pays du monde. Alors la question n'est pas la même, ou la situation n'est pas la même, et nous croyons que les prises de température sont de très bonnes façons d'ajouter une autre couche à nos mesures de sécurité pour nous assurer qu'il n'y aura pas d'infection propagée par nos voyageurs, nos passagers aériens.
Monsieur Garneau me demande si vous pouvez répéter en anglais, s'il vous plaît.
flights.
Yes,
Can you
I'm an
repeat in
engineer, and
English?
so I do believe in science. And I can tell you that if somebody has COVID-19 and has a temperature and wants to take a flight, the chances with temperature measurements are very high that we will detect that person. Is it perfect? No, but it is part of a layered approach that we are taking. And we are also going along with IATA, the International Air Transport Agency, and the ICAO, the International Civil Aviation Organization. These are world bodies that recommend that it be done. Many countries have done it or are contemplating it. In our own country, Air Canada and WestJet have put these measures in place. And I would also say that when people talk about past experience with temperature measurements, they often refer to the SARS situation. That is a situation that involved very small numbers. We're talking here now about millions of people in virtually every country, over 200 countries in the world. So it is a different situation. And I will repeat that it is part of a layered approach. And if a person does have a fever and has SARS, beg your pardon, the coronavirus, there are very high probabilities we will detect that. And that way we can protect Canadians from the spread of this virus.
Thank you, Minister. Operator, next question, please.
Thank you. Our next question is from Teresa Wright from the Canadian Press. Please go ahead. À vous la parole.
Yes, thank you. My first question is for Minister Garneau. Iran's representative to the International Civil Aviation Organization said this week Iran is going to give the black boxes from flight PS752 to France instead of Ukraine, and that this will happen as soon as everyone who needs to be there can travel. Does Canada have any evidence that Iran has made the offer? Do you have any expectation they will follow through this time? And does Canada think it's okay for them to send the black boxes to France and bypass Ukraine?
First of all, we think it is perfectly acceptable. In fact, it's a good idea to send those black boxes to France, and that's why I was speaking at the Council of the ICAO earlier this week. It has been 92 days since Iran promised that within 2 weeks it would move the boxes. We know that the BEA, which is an agency in France, like our Transportation Safety Board, has the capability and the expertise to analyze these boxes, and we are strongly encouraging Iran to move those boxes to Paris as quickly as possible.
Follow up.
Yes, thank you. My next question is for Minister Freeland. Reports that Canada and the U.S. will likely agree to a clean rollover of the border restrictions into July have come as a disappointment to many, including divided families and border communities that depend on tourism dollars. And they want to hear less about whether the border will open and more about how it will open when the time comes. So when will Canadians and Americans start hearing more about how the border will open instead of whether it will?
Well, look, first of all, let me simply say that when it comes to the collaborative approach on the border between Canada and the United States, we are having ongoing, constant conversations with our American partners. I think that it's important for all of us to recognize that so far, our joint collaborative approach to the Canada-U.S. border has been a real success. On one hand, we have allowed essential travel to continue, travel which is so important for our economy, so important for the medical supply chain, and that has really kept on going even at the height of this pandemic here in Canada. And at the same time, we've done the most important thing, which is by putting these restrictions in place, we have been able to protect Canadians and act in a neighborly way towards our American partners. When it comes to decisions about the border in the future, let me first of all emphasize that all decisions about the Canadian border will be taken by Canadians in the Canadian national interest. Of course, we understand that Canada is an open society. We're an open country. We are used to traveling freely, and that is a great thing about our country. I think we all also understand that we are living in truly exceptional circumstances when people across our country have made great personal sacrifices to fight this pandemic. People have stayed home. They have endured tremendous restrictions. And let me point out also that travel within Canada between provinces and territories continues to be restricted in many places. I think all of us are really excited about the gradual reopening of our economy. I think it's a relief. But at the same time, I think it's very, very important for all of us to appreciate how serious this situation is and for all of us to act prudently and carefully. For me, it is such a priority for us not to squander the gains that we have made at great price, a price paid by every single Canadian and paid particularly by people working on the front lines of healthcare, people working at the front lines of our long-term care facilities. So our government's approach is going to be careful, it's going to be cautious, it's going to be prudent. And I'll just conclude by saying we had a good discussion with the First Ministers, the Premiers of the provinces and territories about this really important issue yesterday evening.
Merci, Madame la Vice-Première ministre. Opératrice, prochaine question, s'il vous plaît.
Thank you. Notre prochaine question est de Philippe Vincent Foisier de Radio-Canada. À vous la parole. Please go ahead.
Oui, bonjour. J'ai une question un peu double. Juste, Mme Freeland, je veux comprendre sur les frontières. Est-ce que la prise de température veut dire l'ouverture des frontières? Puis, M. Garneau, est-ce que c'est une décision qui est politique ou une décision qui est scientifique? Parce que ni Mme Tam ni M. Wu est ici.
Regarding temperature screening, is this a scientific decision? Because
concernant la prise des températures à la frontière, comme le ministre Garneau a expliqué, comme le Premier ministre a expliqué ce matin, notre approche est de prendre beaucoup de mesures. Et en prenant une groupe de mesures ensemble, on peut garantir dans la meilleure façon la santé des Canadiens. Chaque mesure individuellement ne peut pas garantir la santé des Canadiens. Mais ensemble, en prenant une groupe de mesures importantes, comme les masques, par exemple, comme la prise des températures, comme la quarantaine, comme les restrictions, la distanciation sociale. En faisant toutes ces choses ensemble, on peut garantir la santé des Canadiens, qui est notre priorité.
Monsieur Garneau.
Mr. Garneau?
J'ajouterais que Mme Freeland a très bien répondu à la question, mais juste une précision. Une précision, les mesures qu'on annonce ce matin sont pour nos passagers aériens. Alors, c'est une frontière absolument importante. Pour le moment, c'est pour nos passagers aériens.
Important, and it's for air passengers currently. A follow-up question?
Donc, ça ne veut rien dire pour l'ouverture prochaine d'une frontière ou de l'ouverture prochaine du voyage non essentiel, si je comprends bien. J'ai une question pour M. Duclos. M. Duclos, sur les chiffres de militaires, vous dites qu'il y a 1400 militaires, les forces et le gouvernement du Québec nous disent 650, 350 qui sont là en supervision, 300 dans les CHSLD. Il y a une guerre de date pour dire qu'il faut que ça soit jusqu'à la mi-septembre, les militaires, on n'est pas clair là-dessus. C'est si compliqué vous entendre et répondre positivement à la demande de Québec. Est-ce que c'est Québec est déraisonnable ou est-ce que vous ne voulez pas vous entendre? Comment ça se fait que ça soit aussi compliqué que ça, être capable de vous entendre avec Québec?
Mais on s'entend très bien, puis en fait, M. Blair, M. Sajan, Mme Freeland d'ailleurs, discutent à peu près tous les jours avec nos homologues au Québec, donc ça va très bien, parce que c'est très important, évidemment. Peut-être un rappel des chiffres et des dates les plus importantes. Les chiffres, c'est depuis quelques semaines déjà 1350 soldats sur place, déployés. Il y en a un certain nombre qui sont en appui aux soldats là, qui, eux, ont une formation médicale ou qui sont en appui sur place dans les CHSLD même à ces autres membres avec une formation médicale. Nous sommes encore, le 12 juin, 2020 avec 1350 soldats sur place déployés. Mais là où ils sont déployés, et en quel nombre dépend évidemment du travail de terrain et des directives des CHSLD qui sont concernés. Mais ces directives évoluent rapidement depuis quelques semaines parce que plusieurs CHSLD qui étaient dans ce qu'on appelle une situation rouge sont devenus dans une situation verte. Donc les soldats n'ont plus besoin d'être là. Ce qui veut dire par exemple que les 25, c'est un autre nombre, et 25 CHSLD qui avaient été identifiés et priorisés par le gouvernement du Québec ne sont plus dans un grand nombre des CHSLD qui ont besoin de la participation des Forces armées canadiennes. En tout, il y a 35 CHSLD qui ont été aidés à un moment ou à un autre par les Forces armées au cours des dernières semaines. En matière de date, ce qui est annoncé aujourd'hui, c'est jusqu'au 26 juin. Ces 1350 soldats vont continuer à être disponibles sur le terrain et affectés selon les besoins et les demandes du gouvernement du Québec, mais on comprend bien que ça se fait de manière locale. Ce sont les CHSLD et les agences de santé publique localement qui déterminent où, quand et comment les membres des Forces armées doivent se déployer sur le terrain essentiellement de la région de Montréal. L'autre date, c'est le 15 septembre. M. Trudeau a rappelé encore ce matin que le gouvernement canadien allait être en appui aux aînés du Québec jusqu'au 15 septembre et peut-être même plus loin. C'est ce qu'il a dit ce matin. Et ce qu'il a dit aussi, ce qui est important, c'est que l'appui additionnel qu'on va chercher avec la Croix-Rouge, c'est une très bonne nouvelle parce que ça ajoute au personnel formé et payé, ça s'ajoute au personnel des Forces armées canadiennes, mais aussi au personnel que le gouvernement du Québec s'apprête à former et à payer lui-même. Donc tout ça, ça donne la possibilité, si jamais il y avait une deuxième vague, d'être encore plus efficace dans notre collaboration qu'on l'était auparavant quand les ressources de la Croix-Rouge canadienne n'étaient pas disponibles.
Merci, Monsieur le ministre. We will now turn to the room, starting with Kelsey from Reuters.
Thank you very much for taking our questions. My questions are for Minister Garneau. Yesterday, the CEO of Air Canada called the Canadian government's measures on travel disproportionate and asked to be able to allow for some type of reasonable business to pursue. I'm wondering what your response to those remarks are. And also, is there a risk with these new temperature checks that people will be even more unlikely to travel and fly?
Well, thank you, Kelsey, for your question. The second part of your question, no, I think with respect to taking temperatures, I think Canadians and international passengers will welcome these and realize that these are an additional layer of safety for Canadians. With respect to the statements from Air Canada, look, I understand they're a business. They would like to fly, and they've been hard hit by this pandemic with respect to their revenues and the number of flights. At the same time, this government has an overriding priority to ensure the safety of Canadians, and that passes through the measures that we have to put in place in the country to make sure that we are going to minimize the possibility of it spreading. And that also includes air travel. And so I'm sure that Air Canada understands this. In fact, Air Canada has been working very constructively with us to implement some of the measures that we've put in place.
And just as a follow-up, you had mentioned that if a passenger has a fever, they're going to be asked to rebook in 14 days. Am I to take that as passengers who have fevers and are denied to fly are not going to get a refund for that flight?
The process at the moment is that we want to make sure that if a person has a fever, and there will be two measurements, 10 minutes apart, that they rebook. We don't want them to enter the secure area and take the flight, and they will be given the opportunity to rebook their flight 14 days later. We will work with the airlines as this program is deployed to see if we can do the maximum possible in the interest of the passengers, realizing that it's in our interest as well as the airline's interest not to allow somebody to take a flight if they have a temperature.
Thank you, Minister. Mackenzie?
Hi, Ms. Freeland. Mackenzie Gray from CTV News. One thing that governments across the country and many Canadians have agreed on is that frontline workers have worked really hard, many of them for very limited pay during this period. That's why a number of companies, including Loblaws and Metro, gave a $2 raise to their frontline employees, the cashiers and such. Loblaws put out their first quarter statements, they made almost $250 million, which is up substantially from last quarter. But coming this Saturday, they are reducing the $2 kind of pandemic pay that is being given to the frontline workers. What's your reaction to that, considering that it's very clear that the virus is still present and that many of these workers, many of whom are racialized and low-income Canadians, have been relying on that money to get through this period of time?
Thanks for the question, Mackenzie. And let me start out by saying how grateful I am personally, how grateful I think all Canadians are and should be to the frontline workers who have made it possible for us to get through this pandemic so far, working in risky and difficult situations. And I think, as you say, Mackenzie, one of the things I think we've realized is many of the people doing the truly most essential jobs in our country are among the people who receive the lowest pay. I think that's something we all need to think about. I would urge all employers to be generous with their frontline workers, to recognize the extraordinary job they're doing, and to recognize the fact that Canadians really, really appreciate it. Our government has been working with the provinces to provide a top-up for essential workers, and that is a recognition by us of how important the work they do is, and of the fact that many of them, as you say, Mackenzie, don't earn very much money.
Moving over to the video of Chief Allan Adam, the RCMP said that there was a reasonable use of force. I have yet to find anyone who's watched that video and thought that that was a reasonable use of force against the chief. What does that say about the RCMP and their culture that they think it was reasonable to do that? And what is your analysis of that video?
You know, let me start by saying I think for me and for all Canadians, those images are incredibly disturbing. And it's right for us to be really disturbed by them. This is a moment in our country when we need to confront the really horrible reality that systemic racism exists here in Canada. Anti-Black racism exists here in Canada. Anti-Indigenous racism exists here in Canada. It is systemic. It exists in all of our institutions, including the police. And we need to acknowledge that. We need to confront that. And we need to work really hard together to end that. In the conversation with the First Ministers last night, the Prime Minister raised the issue of racism in Canada and how we need to do much, much better, including when it comes to policing. When it comes to the treatment of Chief Adams specifically, an independent investigation is happening. That is absolutely essential. And I think that all Canadians will be following that investigation very, very carefully. Our government will certainly be watching it very, very carefully.
Thank you, Deputy Prime Minister. Mike?
Mike Couture from Global National. This is a question for Minister Garneau. Early on, when flights were still coming back into Canada, your government was asked why not screen people with temperature screenings, and at the time, a variety of answers were given, such as, that we just didn't have the staff to put there. I'm just trying to figure out, now you're fully in favor of it, and you're saying that you're anchoring this on science. I don't think the science changed in the last 3 months, so I'm trying to wonder why your government has decided to change its view on temperature screenings at airports now.
Thank you for the question. As Deputy Prime Minister Freeland and as the Prime Minister and as I have said, we have decided that we should take a layered approach which involves a number of factors. For example, we made it compulsory for passengers to wear masks during the flight, and when they could not maintain distance, they have to answer a screening questionnaire. They are now going to have their temperatures tested. We feel that this layered approach maximizes the possibility of us detecting somebody who might have COVID-19 and who, of course, might infect others. So we think that this is the right approach to take, this layered approach that maximizes our potential and our probability of detecting somebody who may have the virus.
I can appreciate that. With all due respect, that wasn't my question. It was, why did you change your mind in deciding to now use temperature checks as opposed to a couple of months ago when that was not the case?
So I will add to that the fact that IATA and ICAO, two world bodies representing all of aviation, as well as countries like South Korea, India, China, other European countries, Canada itself, with Air Canada and WestJet making the decision of taking temperatures. We have looked at the evolving situation and decided that it is a safe and prudent thing to add this as an additional measure at this time, because if somebody does have COVID-19 and has a temperature and wants to take a flight, the probability is very high that we will detect that person and minimize the possibility of spread.
Thank you, Minister. We'll now go back to the phone for 3 questions. Operator.
Thank you. La prochaine question est de Lina Dib de la presse canadienne. À vous la parole. Please go ahead.
Oui, bonjour, M. Garneau. Ma question est à vous encore sur la prise de température. J'essaie de comprendre, nos frontières internationales sont encore fermées, à ce que je sache. Alors, pouvez-vous m'expliquer pourquoi vous commencez par la prise de température des gens qui arrivent de l'étranger et que vous finissez seulement fin juillet avec la prise de température des travailleurs, des voyageurs à l'intérieur du Canada? Je ne comprends pas.
Canada, I don't understand.
On doit faire ça en plusieurs phases parce que ça peut prendre un certain temps pour acquérir l'équipement et mettre en place les mesures pour mesurer les températures. Et ce qui nous motive de le faire, c'est d'abord le fait que nos frontières représentent un potentiel d'introduction du virus de passagers venant de l'étranger où on a moins le contrôle de la situation. Alors, on veut minimiser la possibilité que le virus soit importé parce que les gens peuvent venir de plusieurs différents pays. Alors, ça, c'est une chose. Et deuxièmement, nous sommes tous préoccupés par la possibilité que le virus pourrait rebondir ou recommencer à l'avenir. On ne le sait pas, mais on veut prendre toutes les mesures possibles. Alors, c'est pour ça que dans le pays lui-même, parce qu'il y a des restrictions entre les provinces, qu'on mette aussi les mesures en place pour les vols domestiques.
Lina, juste avant de passer à ton question suivie, M. Garneau, est-ce que vous pourriez répéter en anglais, s'il vous plaît?
Mr. Garneau, could you repeat your answer in English?
Yes. We have decided, as I mentioned, to put in place temperature measurements. First, for international passengers coming into the country, we can put those measures in place quickly. It means that foreign airlines, at the point of departure to come to Canada, will take temperature measurements. Many of them are already doing it before they come into the country. We have less control over what is happening in other countries, and therefore we want to make sure we minimize the possibility of introducing the virus into Canada by air passengers. So that's as a first measure. And secondly, we also want to make sure that we minimize the possibility of spreading it within the country, because passengers do fly from one place to another across the country, and it will take a little bit longer for us to purchase the equipment, set up the procedures so that we can temperature screen people when they're taking domestic flights.
Merci. Lina, en suivi?
Lina, your follow-up question.
Oui, merci. Peut-être je passerai à M. Duclos sur les soldats. Vous maintenez qu'ils sont 1350 qui sont déployés au Québec. Je pense que M. Legault sait compter, puis lui, il en compte seulement 400 à l'ouvrage en ce moment dans les CHSLD. Alors, j'aimerais comprendre pourquoi vous insistez sur cette chicane de chiffres, parce que si les 900 autres presque sont là, mais ils ne sont pas en train de travailler. Je ne vois pas à quoi ça sert de répéter qu'ils sont là. Et pourquoi est-ce que ça prend autant de temps à remplacer ces soldats-là par des gens de la Croix-Rouge? Est-ce qu'il y a une querelle d'argent sur qui c'est qui payerait cette aide dans les CHSLD, cette aide qui vient d'Ottawa? Pouvez-vous m'expliquer?
Très bien. Écoutez, le message principal, c'est que dès le début, on a dit très clairement que le gouvernement canadien allait être là tant que le gouvernement du Québec allait juger nécessaire sa participation dans les soins dans les centres de soins de longue durée au Québec. Il y a aujourd'hui, et il va y avoir jusqu'au 26 juin, 1350 membres des forces armées disponibles, déployés pour intervenir dans les CHSLD. La manière par laquelle ces membres des forces armées canadiennes se déploient dépend des directives et des demandes des CHSLD sur place. Il y a eu, au cours des dernières semaines, une amélioration substantielle dans la plupart de ces CHSLD. C'est pour ça qu'au début, même s'ils étaient déployés exclusivement dans seulement 25, ils ont agi dans environ 35 jusqu'à maintenant. Et on s'attend à ce qu'ils soient déployés, toujours à la demande du gouvernement québécois, dans d'autres CHSLD au cours des prochains jours, jusqu'au 26 juin. Maintenant, en plus de la continuation de cette collaboration et de cette action importante des Forces armées canadiennes, le premier ministre Trudeau a annoncé ce matin que jusqu'au 15 septembre, il allait avoir une participation du gouvernement canadien pour continuer d'être en appui aux aînés au Québec, que cette participation allait inclure en plus des ressources pour l'instant non existantes et non utilisées de la Croix-Rouge, des gens formés et bien payés pour faire le travail dans les CHSLD. Ça, c'est une très bonne nouvelle parce qu'on sait qu'au Québec, un des gros enjeux, c'est la disponibilité des ressources humaines. Qui va payer pour ça? C'est le gouvernement canadien qui s'est engagé à le faire, tout comme il a contribué, évidemment, et naturellement et tout à fait correctement en déployant au cours des dernières semaines les membres des Forces armées canadiennes.
Canadian Armed Forces in the past few weeks to offer assistance.
Next question, please.
Thank you, Mr. Minister. Next question, please.
Merci. Our next question is from Brett Forrester from APTN National News. Please go ahead. À vous la parole.
Hello, Deputy Prime Minister. Indigenous people in the territories are pursuing a class action lawsuit alleging widespread police brutality and systemic discrimination by RCMP in the three territories. Given what you just said on that topic, do you think the RCMP should negotiate a settlement in that case?
Thank you for the important question. I'm not going to comment on a case which is before the courts right now. But let me be clear, as the Prime Minister has been, that our government understands that systemic discrimination exists in Canada. Systemic racism exists in Canada in all of our institutions, including the police. That's something that we need to acknowledge, we need to confront, and we need to work to end.
Thank you. Thank you for that response. The other day in the House, you referred to the need for root and branch reform when it comes to policing, especially in Indigenous communities. Can you explain what that means and how the government can make police more accountable to the Indigenous communities they are supposed to protect and serve?
Thank you again for the really important question. I'm sure you would agree with me that we could all spend the rest of today and probably the rest of this month talking about it. It's a big, challenging issue. And to offer a short reply to a very big question, I think the place to start is for the government to listen to Indigenous people in Canada.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you. Our next question is from Hélène Buzetti du Devoir. Please go ahead, à vous la parole.
Oui, bonjour. Ma question serait pour le ministre Garneau. Une question un peu technique, mais pouvez-vous nous donner la date précise? Là, vous avez parlé de fin juin pour cette entrée en vigueur de la prise de température. Et si j'ai bien compris, donc, si on teste avec une température trop élevée, on doit rebooker dans 14 jours. Est-ce que c'est pas un peu long? Ça arrive parfois qu'on fasse juste une petite poussée de fièvre et qu'on n'a pas nécessairement un gros virus. Et ça vous avait pas été clair s'il faut reprendre un autre vol plus tard. Faut-il payer en tant que passager ou ça sera inclus dans le prix?
Merci pour vos questions, Hélène. Pour expliquer les dates, l'entrée en vigueur de la mesure de la température pour les vols venant au Canada, c'est-à-dire les passagers internationaux, serait à la fin du mois de juin. On espère qu'à la fin du mois de juillet, les mesures seraient en place pour mesurer la température dans les 4 plus gros aéroports pour les vols domestiques et les vols qui s'en vont à l'international. Et d'ici la fin de septembre pour les 11 plus gros aéroports suivants. Alors ça, ce sont les dates. Si une personne a une température et on va la mesurer 2 fois avec un écart de 10 minutes entre les 2 mesures, la personne, on a décidé que la chose la plus prudente à faire, c'est d'exiger qu'ils attendent 14 jours avant de réserver un autre vol et on travaille avec les compagnies aériennes pour qu'il n'y ait pas de pénalité dans le prix qu'ils seraient obligés de payer pour leur vol de remplacement.
Et,
just a moment, Minister Garneau, could you please repeat that in English as well?
Very good. So with respect to the dates to bring the temperature testing into place, for international passengers coming to Canada, that would be at the end of June. For domestic passengers, it would be at the end of July in our 4 largest airports. That is for domestic flights or flights leaving the country, but from those 4 largest airports, end of July. And for the 11 next largest airports, it would be the end of September. If a person has an elevated temperature measurement, and we would do 2 measurements 10 minutes apart, just in case the person, let's say, was running very vigorously to catch their flight and there was a temporary elevation in their temperature, we would take the temperatures 10 minutes apart. If the person still had an elevated temperature, we would require them not to rebook for 14 days. That's an arbitrary but prudent amount of time. And the intention is that, and we're working with the airlines, is that the rebooking would not be more expensive. It would just be a rebooking to a different date.
Alors, M. Garneau, j'avais compris fin juin, là, je me demandais juste s'il y avait une date plus précise. J'en comprends qu'il n'y en a pas pour l'instant. Mais ma question de suivi, ça serait de savoir, est-ce que ça s'applique aussi pour les Canadiens qui sont à l'étranger et qui voudraient revenir au pays? Pourraient-ils eux aussi être interdits s'ils montrent de la température? Et dans ces cas-là, comme il s'agit de Canadiens et donc ils veulent revenir à la maison, si on les fait attendre 2 semaines de plus à l'étranger, y aura-t-il une sorte de compensation, puisqu'on peut imaginer qu'ils devront prendre des chambres d'hôtel et il y aura des coûts associés à leur séjour prolongé de force.
Merci. Je pense qu'on est tous d'accord pour dire qu'on ne veut pas créer un risque quand une personne qui pourrait avoir la COVID-19 prenne un vol pour revenir au Canada, que la personne soit canadienne ou non. Alors, en ce moment, l'intention, c'est, si la personne a une température, c'est de demander à la personne de réserver au moins 14 jours plus tard. En ce moment, il n'y a pas d'autres mesures qui seraient en place, sauf que le prix du billet 14 jours plus tard serait le même.
We would like for the rebooking fee to be the same 14 days later. One last question.
Good afternoon, Minister Garneau. Ashley Burke, CBC News. Privacy experts have warned that it could be a breach of privacy laws here in Canada if people are asked to have their temperature taken, if it's unnecessary and not evidence-based. Have airlines asked you to make this mandatory so it's required so they do not come across privacy issues later on with the Privacy Commissioner?
So thank you, Ashley, for the question. And we ourselves, of course, look at these matters before we make decisions. And In this particular case, we're talking about a national safety measure to protect Canadians. And we feel that, based on all of the expert advice that we have, that this is a very reasonable measure to put in place to ensure the Canadians are protected.
But have airlines asked you to make this mandatory? And also, Minister Freeland, there are reports that Americans are showing up in Banff without self-isolating for 14 days, that they're telling border officials that they're on their way to Alaska, which is allowed, but then they're staying there for non-essential reasons, for vacation, perhaps, and they're not quarantining for 14 days. Can you also respond to that and tell us what you're doing?
Yeah, go ahead, Mark, if you want to add anything.
Okay, so there are a number of measures in place, including quarantine, and we expect people to follow those rules, and we do spot checking on them. There will be cases where people do not do it, and we believe that that's an irresponsible thing to do. We're largely satisfied that most people follow the requirements that are put in place. We cannot guarantee 100% that everybody is going to do it, and we are, to some extent, assuming good faith on the part of people at this point in time.
And I'll just add, when it comes to the Canada-U.S. border, I do want to emphasize that the reciprocal arrangement that we have with our American neighbors is working really well overall. We have managed to simultaneously restrict non-essential travel, and there is much, much less travel than at normal times, and to still have the absolutely essential travel that our economy depends on, that our medical supply chain depends on, to have that travel continue. One of the things that both Canadians and Americans need, some of us, is to be able to travel through each other's countries as part of our regular lives. I think we are familiar with people in Campobello, for example, Canadians who need to travel through the U.S. just as part of their daily existence. And likewise, some Americans need to travel through Canada as part of their, to get to another part of the United States. Having said that, border guards do a great job and ask questions to determine whether these journeys that people are making are for essential travel or not. And I would just like to emphasize to all Canadians, to all Americans, that these restrictions are there for a reason. They are there to keep us all safe. Please do not come to Canada unless you are coming for an essential reason. And I want to thank our border guards for doing a really, really good job. It's really hard. I have been really positively impressed by the extent to which our border guards have successfully managed to restrict the non-essential travel and keep the essential travel going. Thank you.
Thank you, Deputy Prime Minister. Ceci met fin à la conférence de presse pour aujourd'hui.
This concludes today's press conference. Thank you.